Thank you both. Thanks also to the campaign as well as the Senate and House sponsors of today's event. I'm Matt Longjohn. I'm a physician by training, but the Senior Director of Chronic Disease Prevention Programs at the YMCA of the USA, which is the National Resource Center for all the Ys around the country. That's what I do currently. A couple little bits of history is I've also been privileged to work on the ground, community coalitions. I was a founding executive director of CLOC, the Consortium to Lower Obesity in Chicago Children, as well as a fellow at a group called the Altarm Institute, where I was able to write about surveillance systems quite a bit. So I'm thrilled to be here, and thank you for your kind words about the partnership with CDC. The Y has, as Dr. Frieden said, a very long history of working on not just healthy communities initiatives, but injury and drowning prevention activities, arthritis management control, as well as prevention programs, the diabetes prevention program. The list kind of goes on, and we're thrilled to be seen as a part of the CDC in various settings. So a little bit about the Y to begin with here. The Y is a federated nonprofit organization, which means that there's all the Ys that you think of in your community that are have swim pools and fitness facilities, etc. Those buildings are essentially a part of a big national thing. There are 10,000 communities, more than 10,000 communities in the United States served by programs that the Ys run. And by and large, those staff work out of about 2,700 buildings that you might know. And those 2,700 buildings are all part of 900 separate nonprofit organizations. They each have their own CEOs, etc. And those are a part of the Y. We have, throughout the country, it ends up that 57% of US households live within 3 miles of a Y. And if you stretch that radius out to about 5 miles, it's something about 75–80% of US households live within 5 miles of the Ys. And that's important for the story I'm going to tell a little bit about NHANES, because over 200 of those 900 organizations, separate nonprofits, have been involved in things like Achieve and Pioneering Healthy Communities and Community Transformation Grants and REACH, various community coalitions around the country to address social determinants of health. And for the last 10 years or so have been actively involved in either participating in or in some cases really leading community coalitions around health. And the value of NHANES, I think, can't be understated when you think about hundreds of communities and hundreds of organizations such as the Y, certainly not just the Y, that are using NHANES data every day to make decisions about how they prioritize their time and efforts and what kinds of community enhancements or program activities should be in play in those communities. There are many, many partners that Ys have in these communities, and so it's maybe not surprising to think about how, when you get focused with NHANES data, how effective you might be able to be in these big coalitions. We've been able to track over 26,000 specific community enhancements that have been made through these coalitions. Sometimes that's extra miles of sidewalk or more farmers markets or a variety of things. Healthier child care operations, healthier schools, etc. And the Ys have been pleased to be a part of a lot of those activities, those changes. But our vision as a nonprofit is to be a really important partner in public health delivery and to help foster community change. That's a 160-year history. Again, NHANES really helps us do that. The experience that Ys have kind of told the national Y about is that, of course, it's always better to start with data. When you pull together community coalitions, when you start thinking about how can we improve our community, you don't know if it's going to be a sidewalk here or a farmer's market there or et cetera. Really assessing community need is vitally important. And NHANES is often the basis for how these community coalitions begin their work. As Dr. Frieden said, the meticulous nature with which NHANES has been constructed and delivered across the country gives Ys and their partners a great deal of confidence in using those same questions. We know that they've been validated. We know that they are questions that are reliable. And so just sometimes being able to take the same questions and asking them in your community gives you great faith about what kinds of responses you get back. As I said, it helps set priorities, etc. A couple things about NHANES. Maybe this was mentioned and I kind of glazed over with the star power on the panel here, but you know, they aren't proxy data, right? These are directly collected data. Other data that are available at the community level are sometimes less reliable because, you know, a parent might not remember exactly how many centimeters tall their child is, or you know, how many pounds they weigh that month. You know, knowing that NHANES data were you know, reliable is really important as they think about, community coalitions think about what to do. The stories that I'll close with here are just examples of how NHANES is used. So these were stories that were collected by WISE as we were preparing for this panel. So 1Y in Ann Arbor, Michigan works with Washtenaw County, their local health department, to basically take the questions from NHANES, not the mobile vans and all that kind of stuff, but uses it actually every couple years to do door-to-door surveys and mail-out surveys, et cetera, to really assess the community need, assess the community gaps in terms of programs and opportunities to address health needs. And through all kinds of community process, working through committees, et cetera, they end up deciding which programs are needed in their community or what changes need to happen. So whether it's the diabetes prevention program or you know, more sidewalks, you know, the WISE and the health departments at that local health department, at that county level, really sit down and think about how they can address these community needs after they've gathered that data. Another point that's really important is measuring effectiveness. In previous history in Chicago, WISE could tell you this too. You know, the city of Chicago decided about 10 years ago through a coalition to try and monitor childhood obesity rates, and it was NHANES data that allowed the city to really compare itself to anyone else. And through community partnerships and NHANES questions, you know, that gap was assessed. It turned out in 2003, compared to NHANES data, the Chicago kindergartners were entering school 2.3 times more likely to be obese kindergartners than even the NHANES national data would have led us to believe. So think about this from a community organizing standpoint. If we're going to do stuff to address childhood obesity, and we spend a ton of political capital locally as community-based organizations, or a ton of energy even, just a ton is another technical term, I think, to address childhood obesity, and we had then, after 5-7 years, looked back to see how we did, and found that the rate of childhood obesity amongst kindergartners was, you know, 1.8 times the national level, we might have thought we had failed. But because NHANES data were available and you know, were something that we could compare to 10 years earlier, we knew that 1.8 would have actually been a success. So measuring effectiveness is possible because of these surveillance systems, and NHANES in particular. Last example is related to the National Youth Fitness Survey, the new component of NHANES. About a year ago, the Y made a commitment to the First Lady and the Let's Move folk and said that not only are we going to be the largest provider of child care and after-school programs around the country, we have over 9,700 programs for after-school participation, etc., but we wanted to be the healthiest. So we set up, with the First Lady's team's help, some standards that were based in large part on NHANES data, on what was, you know, known to be effective kind of messaging and programming and operations, and are now pushing to have all our child care and after-school centers achieve that those new set of standards. And the National Youth Fitness Survey has questions in it that are connected to after-school programs for the first time. So, you know, all of this hopefully is a good story to tell you that, you know, WISE and other community-based organizations are really using this system for a variety of things, whether it's program development, program dissemination, community coalition building, and it's a vital part of our work.
So I think we have time for some questions.